Hello everyone. In this training video, I'm going to go over 6 things to look for when choosing Medicare drug coverage. This information is being pulled from the Medicare.gov website. Number 1, I take specific drugs. If that is your case, look at drug plans that include your drugs on their formulary. A formulary is simply a list of prescription drugs covered by a prescription drug plan or another insurance plan offering prescription drug benefits, also called a drug list. Then compare costs. I want extra protection from high prescription drug costs. Look at plans offering coverage in the coverage gap, and then check with those plans to make sure they cover your drugs in the gap. Coverage gap is a period of time in which you pay higher cost sharing for prescription drugs until you spend enough to qualify for catastrophic coverage. The coverage gap, also known as a donut hole, starts when you and your plan have paid a set dollar amount for prescription drug coverage that year. Step number 3, I want my drug expenses to be balanced throughout the year. If that is you, you must look at plans with no or a low deductible or with additional coverage in the coverage gap. A deductible is the amount you must pay for health care or prescriptions before original Medicare, your prescription drug plan, or your other insurance begins to pay. Again, the coverage gap we've already gone over. I take a lot of prescriptions, generic prescriptions. Look at plans with tiers that charge you nothing or low co-payments for generic prescriptions. Tiers are a group of drugs that have a different cost for each group. Generally, a drug in a lower tier will cost you less than a drug in a higher tier. Step 5. I don't have many drug costs now, but I want coverage for peace of mind to avoid future penalties. Look at the plans with a low monthly premium for drug coverage. If you need prescriptions in the future, all plans must still cover most drugs used by people with Medicare. A premium, we all know, is the monthly payment to Medicare, an insurance company, or to a health care plan for health or prescription drug coverage. I like the extra benefits and lower costs available by getting my health care and prescription drug coverage from only one plan, and I'm willing to accept the plan's restrictions on what doctors, hospitals, and other healthcare providers I can use. If this is you, look for a Medicare Advantage Plan Part C with prescription drug coverage. Medicare Advantage plans are simply types of Medicare health plans offered by private companies that contract with Medicare. Medicare Advantage plans provide all of your Part A and Part B benefits. Medicare Advantage plans include HMOs, PPOs, private fee-for-service, special needs plans, and Medicare's medical savings accounts. If you're enrolled in a Medicare Advantage plan, most Medicare services are covered through the plan. Medicare services aren't paid for by original Medicare. Most Medicare Advantage plans offer prescription drug coverage. Again, what we just went over are the 6 things to look for when choosing Medicare coverage. Thank you very much for your time. Have a great day.